In this lecture, we're going to discuss both osteomyelitis and septic arthritis in children. Osteomyelitis and septic arthritis are both more common in summer months, possibly because of trauma, but it's not really clear, but we do see it more common in the summer. They often occur after a preceding, seemingly innocuous injury to the bone or the joint. About half the time, it's known to have happened. These patients then have a transient bacteremia. Maybe it's from brushing their teeth or picking at their nose or whatever, but they develop a transient bacteremia, and that bacteria happens to land exactly in the spot where the bone or the joint was bruised. Then they gradually grow and the patient presents with a bone or a joint infection. Very, very rarely, this can also happen from a penetrating trauma that gets into a joint or into a bone, but we don't see that very commonly. There are only a few organisms that are likely to cause a bone or joint infection. By far and away the most common is Staph aureus. Also, patients can get group A strep. Very rarely, patients can get Streptococcus pneumonia. There are some special considerations for certain bacteria that are specific to certain groups of patients. Kingella is a gram-negative rod that causes both osteomyelitis and joint infections in children under 6 years of age. In adults, this is one of the Hayseck organisms, one of those organisms that has gram-negative rods implicated in endocarditis. However, in kids, we see this in bone and joint infections. Generally kids under 6, they tend to have milder disease, and Kingella is hard to grow in the lab, so if the culture is negative, it could be Kingella. Group B strep can cause osteomyelitis or joint infections in children under 3 months of age. They've acquired this through the birth process. Salmonella is possible in children especially with sickle cell disease. Gonorrhea is possible in sexually active adolescents, although usually gonorrhea causes a tendinous involvement as well. And lastly, Pseudomonas aeruginosa is possible in IV drug users, although we see this much more in the adult population.